is similar to anyone I know. You know, it's just things like that make it easier to.
There are things you don't have to explain.
Exactly. It's a lot of things that you don't have to say because they already did.
It's definitely a big deal. It does matter. I think it brings a level of comfort because one of the things that we all have in common, particularly in the African American community, is, you know, we know some of the struggles, we know some of the biases. You know, we all have had these encounters, you know, being misunderstood, you know, being labeled.
Smith works in schools, runs a summer program, and provides therapy largely to clients who live on Chicago's south and west sides, where many of the city's black residents live.
It's a lot of work, it's a lot of need, and it's not enough people.
Experts say there is a lack of black mental health professionals across the country, despite a growing demand for such services. In 2012, the city of Chicago closed half its public mental health clinics, mostly ones located on the south side. By 2020, according to one analysis, the provider-to-population ratio in some areas was about a tenth of the national rate. Officials have announced plans to reopen at least one clinic and expand services elsewhere, but
there's still a great deal of work to do in order to ensure that those who are in need and at risk are receiving support that could ultimately save their life.
University of Chicago professor Janelle Goodwill has studied the rise in suicide deaths among the city's black residents, including youth.
When I speak with families who have already lost their child or families who are currently living with the reality that their child is at risk for suicide, one of the main questions I'm asked is, how do I find a therapist? How do I find a clinician? How do I find a black clinician in this area? And so I know that that's something that is really impacting so many families. And so there's a great need to ensure that there's enough providers available to service all those in their need.
In 2020, licensed clinical social worker Kamisha Jones started Sista Afia Community Care. It provides free therapy specifically for black women and girls, a population that's seen one of the biggest increases in suicide both nationally and in Chicago. Jones, who's dealt with her own mental health issues, says her clients rarely face just one kind of stressor.
If a black woman were to come to me and she's like, you know, I'm taking care of my children, I'm also taking care of my parents, and I just feel really stressed and stretched really thin because of all of these things that I'm juggling, I would automatically get that. Everything that we've been through in this country and we're still here is powerful, but all the things that we're growing through to still exist in this society is really difficult.
That, Jones says, is partly why it's so important to get more black providers into the field. One barrier is licensure requirements. A 2022 report found that 84% of white people who took the licensed clinical social worker exam passed on their first try. For black applicants, that rate was just 45%, and only 57% of black applicants ever passed the test. So last year, the Illinois legislature passed a law allowing an alternative for obtaining a license, completing an additional 3,000 hours of supervised practice.
With where things are at right now with mental health in our communities and in this country, the more that we can open it up for people who really want to do this work, I think is a huge asset.